Hi, my name's Dr. Luke Smith, chiropractor and functional medicine practitioner. Now I'd like to explain the link between chiropractic care and ear infections. Now, in the ear we have a small tube that goes from the inside of the ear to the back of the throat. Now this tube is called the eustachian tube. Now what the eustachian tube does is it acts like a drain for the inner ear. So when the inner ear produces mucus or fluid builds up, or the pressure of the air is different to inside the throat, then the tube opens up and allows either the fluid or mucus to move to equalise it, or the air pressure to equalise. Now sometimes that tube blocks up, sometimes that tube blocks. Now the way that works is that the tube is made up of muscles, and the muscles can go into spasm, just like any other muscles in the body. Now if the muscles go into spasm, it blocks up the tube, and then you get a build-up of pressure and mucus and fluid and even air inside the ear, and it's not able to equalise and drain. And if it stays like that for a while, you can develop an infection. Now, how does it get blocked in the first place? There are several reasons why it can get blocked. One of the very common reasons it's often overlooked is irritation to the nerves in the neck due to subluxation of the top of the spine. Now what that means is if the top of the spine, the alignment of the joints gets out of alignment, it can irritate the nerves. Some of those nerves then control the tiny muscles that make up the lining of the eustachian tube. Now if those nerves are irritated enough, it'll cause the muscle to spasm, and it can't actually open and close normally, and then you'll get the pressure build up and infection result. So what we can do as chiropractors to help that is we can make a chiropractic adjustment to correct the alignment at the top of the spine, reduce the pressure on the nerves at the top of the spine, and allow them to function normally so that the muscle spasm calms down, so that the eustachian tube is able to open up and properly drain the ear of the fluid and the mucus. Now, a very important point with ear infections, and especially kids that get chronic ear infections, is they're very commonly associated with food sensitivities. Now, the most common food sensitivity that we find in kids that get ear infection after ear infection after ear infection is a sensitivity to dairy. Particularly pasteurised dairy seems to be quite reactive to a lot of children. So it is worth noting that if you never get them off dairy, it will actually cause more mucus to be produced, and the mucus itself can block up the eustachian tube. But more often than not, there's a few issues going on with these kids, but one of the main ones that often will resolve the kids' ear infection problems altogether is correcting the subluxations at the top of their neck. So what I'd suggest you do if your child suffers with ear infections is get them checked by a chiropractor. We can check the alignment, we can make sure that's okay. If it's not okay, we can adjust that back to its normal alignment and help the nerves and help the eustachian tube drain. And just remember, creating health is a choice that begins with you.